Levomilnacipran is a selective serotonin and norepinephrine reuptake inhibitor, SNRI, used to treat major depressive disorder, MDD, in adults. In this video, let's find. What is levomilnacipran? What is levomilnacipran used for? Contraindication. What are the side effects of taking levomilnacipran? How does levomilnacipran work? How to use levomilnacipran? What is levomilnacipran? Levomilnacipran is an antidepressant which was approved in the United States in 2013 for the treatment of major depressive disorder in adults. It is the levorotatory enantiomer of milnacipran, and has similar effects and pharmacology, acting as a serotonin, norepinephrine reuptake inhibitor. What is levomilnacipran used for? Levomilnacipran is a serotonin and norepinephrine reuptake inhibitor indicated for the treatment of major depressive disorder, MDD, in adults. Contraindication. Hypersensitivity. MAOIs. Do not use MAOIs intended to treat psychiatric disorders with levomilnacipran or within 7 days of stopping levomilnacipran due to an increased risk of serotonin syndrome. Do not initiate levomilnacipran within 14 days of stopping an MAOI. Side effects. Side effects seen more often with levomilnacipran than with placebo in clinical trials included nausea, dizziness, sweating, constipation, insomnia, increased heart rate and blood pressure, urinary hesitancy, erectile dysfunction and delayed ejaculation in males, vomiting, tachycardia, and palpitations. Pharmacodynamic. Levomilnacipran is an antidepressant that binds with high affinity to human serotonin, 5-HT, and norepinephrine, northeast, transporters, Ki equals 11 and 91 nm, respectively. It potently inhibits 5-HT and any reuptake, IC 50, 16, 19 and 11 nm, respectively. Levomilnacipran does not bind to any other receptors, ion channels, or transporters, including serotonergic, 5-HT1-7, alpha and beta-adrenergic, muscarinic, or histaminergic receptors and CA2+, Na+, or Cl channels to a significant degree. Levomilnacipran did not inhibit monoamine oxidase MAO. Furthermore, levomilnacipran does not prolong the QTc interval to a clinically relevant extent. Mechanism of action. Levomilnacipran is a potent and selective serotonin and norepinephrine reuptake inhibitor, SNRI. The exact mechanism of the antidepressant action of levomilnacipran is unknown but is thought to be related to the potentiation of serotonin and norepinephrine in the central nervous system through inhibition of reuptake at serotonin and norepinephrine transporters. Like milnacipran, levomilnacipran is a more potent inhibitor of the norepinephrine transporter than the serotonin transporter. It exhibits over a 15-fold higher selectivity for norepinephrine versus serotonin reuptake inhibition. Half-life. The apparent terminal elimination half-life of extended-release levomilnacipran is approximately 12 hours. Dose. Major depressive disorders. SNRI indicated for major depressive disorders in adults. 20 mg POQ day x 2 days initially, then increased to 40 mg POQ day. Based on efficacy and tolerability, increase dose in increments of 40 mg per day at intervals of 2 or more days, not to exceed 120 mg per day. Dosage range, 40 to 120 mg/day. Safety advice. This drug should be used during pregnancy only if the benefit outweighs the risk to the fetus. US FDA pregnancy category, not assigned. Risk summary. There is insufficient data available on use of this drug in pregnant women to inform a drug-related risk. That's all the information about levomilnacipran we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.